Hello, I'm Dr. Brandt Gibson, and today I want to talk to you about another way to test peripheral neuropathy. This is the sharp, dull sensation test. And this is done in a very similar manner to some of the other tests. However, it's done in just the three dermatomes right near, just right near the ankle. And we kind of roll it across the foot in that area, trying to check to see if they can feel sharp or dull. There are a couple different ways you can test sharp and dull. The old way, the way we used to do it, is we take like a Q-tip type or stick, and we break it. We'd have the cotton swab on one side for the dull, and the sharp would be the point from the broken stick. And it allowed us to differentiate pretty well, and we kind of test it similar to the way we did temperature that we talked about yesterday, where you're touching a few different spots in different areas to check all of the several of the nerves that are coming to the foot and ankle to kind of evaluate that way. What we now do in our office, for example, is we use a instrument that looks more like a cowboy spurs, where they have the wheel that has the points on it, and we roll it across, and it's sharp. But if it feels really uncomfortable, really sharp, that's abnormal, or if it feels really dull, that's abnormal. In both cases, that differentiates it and says, okay, in the medial portion or the inside of the foot, the top of the foot, or the outside lateral side of the foot, they have a problem. That particular nerve has a problem sensing sharp. It's a simple way to test it. It's quick, and it allows us to say, is that portion of the nerve malfunctioning? What does it tell us? It tells us if they have a peripheral neuropathy in that case, in this sharp, dull situation. This is very important because if you can't sense sharp and dull, you also have possibilities of getting sores and injuries from things inside your shoe or areas in your shoe that are rubbing or those kind of things. So this is Dr. Brandt Gibson. This is your Neuropathy Nugget, day 63, sharp, dull. It's important that you test, when we're testing pressure sensation and temperature sensation, that we also test the sharp, dull to evaluate if that portion of the nerve is functioning like it should.